Doctor, I'm sure you've had a look at some of the data that's come out of that trial. What have you learned?
Well, it's a pretty impressive result in a very controlled clinical trial. So what's going to happen is the FDA will review it really carefully, and then if it is authorized, which I think is a pretty fair bet, then we'll see how it performs in the real world. A really important thing to keep in mind is it does have to be given in the first few days of illness. And so that really means people need to get to care to know it exists. And it's kind of similar in that sense to monoclonal antibodies, which are very effective also, but many people can't get to in time.
Dr. Sharfstein, this goes to distribution as well. In other words, how much are drugstores, pharmacies, actually the first responders when it comes to some of these viruses, if they could test and then distribute these drugs in short order rather than waiting to go to the doctor and get a prescription, some of the rigmarole that keeps people from getting certain medications quickly?
Totally fair question. And I think as we, understand the data on this medication, that may be an approach to take. I mean, it's not necessarily too hard for people who have doctors to get in touch with them and get prescribed things quickly, but you're right. A lot of people don't have doctors, and this may be a case, depending on what the evidence is, that where it would make sense for there to be rapid approaches, standing orders, pharmacy prescribing, but have to take one step at a time.
This is one notch on the reopening moment that we seem to maybe be in. There are some people talking about a fourth or fifth wave, but it's diminished relative to where we were earlier in the year. And you are seeing travel reopen, certainly with the corridor between the U.S. and the United Kingdom. How much does this indicate a reopening versus perhaps introducing danger? In other words, was there a reason for this to be as closed for as long as it was from a virologist point of view?
Well, I mean, from a public health point of view, some of the travel restrictions really haven't made a huge amount of sense because there has been so much virus inside the United States. So restrictions, such as restrictions at the border, have always been a puzzler. The real challenge has been within the border and controlling things. And we still have 75,000 infections a day. So I do think that we're moving back towards a new normal. The new normal is not going to be the same as 2019, but I do think it's going to feel a lot more like we have our lives back.
Does this reduce the urgency to vaccinate the remaining population, this pill?
Well, see, here's I think one of the big challenges, that the same population of people in many places, not in all places, who are reluctant to get vaccinated may be reluctant to go and get tested for COVID in the first place and find out that they need the pill until it's too late. So, the best thing by far is to get vaccinated. The other thing to keep in mind is that viruses can adapt and can actually escape from some of these antiviral treatments. So, what looks good in one clinical trial now might not look good a year from now as the virus mutates. It's actually, in some respects, easier to mutate away from a pill than from a vaccine.